One. Hi, I'm just here to tell you a little bit about music therapy and how it helps individuals suffering with depression. So, I became interested in music therapy because basically I like the fact that it empowered people and it was like a self-help instead of like traditional drugs like medication, which obviously have a lot of side effects. So I think firstly, before I talk about music therapy, it's like essential to learn about like what depression is. Um, it can be established that depression is more than just generally feeling sad or upset or unhappy for a few days. Um, Individuals who are diagnosed with depression may feel persistently sad for weeks or months, and this can include symptoms such as lack of pleasure when it comes to things like that they used to enjoy, and loss of interest, reduced energy, um, poor concentration, attention, low self-esteem, feelings of guilt, unworthiness, pessimism, disturbed sleep, and many self-harm or even develop suicide feelings. And this is why I think it's so important to learn about something like music therapy, as drugs obviously do help these symptoms. However, sometimes it doesn't help the individuals help themselves, so something like this can help get to the root cause instead of just treating the symptoms. Doctors also, it's just important to note that doctors also diagnose depression according to like the severity of it. So you can have like a mild form of depression, a moderate form, and then a severe form. And it's important as well to mention that with music therapy, as much as it is good to help symptoms of depression, something like the severe form of depression would need to be in conjunction with another form of medication or something like that, because it won't help the severity of a severe depression. So depression as well is seen as one of the most common psychiatric disorders, and is also the third most common reason for individuals to seek help from a doctor, so it really is quite common, and that's another reason why I'm really interested in music therapy. Another little fact on depression is how 6% of adults experience an episode of depression over their lifetime. And the World Health Organization also state that by 2020, depression will be the highest ranked disease burden in developed countries, just showing how much it is important to get awareness of things like music therapy and other things that are seen to help depression. So now I've told you a little bit about what depression is, and obviously the drugs that can treat it, but that music therapy is like an alternative method. I'm just going to tell you a little bit about what music therapy is and how it treats people with depression. So, sorry, one second. So with music therapy, people often believe that it's just like listening to music, and this will like obviously help reduce your depression. However, even though this is shown to help depressive moods, music therapy is very different, and it's a lot more complex than just listening to music. Music therapy seems to be very current in America, and research within the area is becoming widespread. However, music therapy is defined by a leading psychologist as being an interpersonal process in which the therapist uses music and all of its features to help patients to improve, restore and maintain health. It can be seen that music therapy is a very unique process, and it does seem to be tailored to the individual. It seemed to make a difference to many people's lives, and the effectiveness of it is seen to be very good. So many like psychotherapists and things in the area, especially young, she says how music therapy opens another avenue to communicate, where a lot of other depression treatments such as counselling fails to do so, so it like knocks them barriers down that communication has to offer. It's another thing that's important to note is how the music therapists are really highly trained individuals, and they all have to obtain a degree classification, often in music studies, and they do have postgraduate courses as well, so it's not just a job that anybody can do. It is highly trained professionals, which shows the how complex that music therapists can be. Music therapy can take numerous routes, that, and they are all client-centred. In general terms, music therapy sessions often begin with initial meetings so that the client can get to know the therapist, counsellor and so forth, and it helps build the rapport so that they both feel like calm when they talk to each other. It will be explained to the client what the sessions will involve, as well as establishing how music therapy will provide positive outcomes to the individual's life. And as there are many pre-misconceptions about what music therapy involves, this will be explained to the client. One of the main misconceptions is that individuals must know how to play an instrument or be able to sing, but this is completely untrue, and you can it can involve anything, and the sessions just simply can involve playing the music freely. You can make up the music as you go along, and it's shown to help. By doing this, it helps you and the counsellor or therapist understand like your deepest feelings and experiences as it comes through in the music. In a music therapy session, the music therapist can create a range of music with the clients by playing, making up music, singing, creating songs that reflect the current mood, simply listening to music, dancing or moving to music, and other contexts that the client or the individual feels that may help them. So anything that involves music, the client can engage in, and if this is seen to help them, then the therapist will go with that. It can be seen that the way that the individual plays the instrument, chooses to write a particular song, can all highlight the individual's present state to the therapist, allowing the therapist to currently support the client in many ways, from their current emotional state, the behaviour they express, and their self-awareness. If the individual is feeling depressed, music therapy can help the individual explore why this may be, allowing the individual to express individuality, creativity and personality. Due to the diversity of the sessions, two of the methods that could be adopted in a session I will talk about now. So firstly, as stated, music therapy can involve the individual using instruments or their voice to express ideas and feelings. Every music therapy session, as highlighted, is seen as completely different as it is catered to the individual. The sessions focus upon how the individual actually uses the instrument, not how good they are at it, just how they use it, as this will begin to reflect the individual's emotional state at that current moment in time in the music session. Once the emotional state of the client is actually established, the therapist will actually go with this, and there will be a flow, and they'll meet the client where they are in that moment of time, and then just go through the process with them, and this will help the client feel they're being listened to and supported by the music therapist. So if the client is depressed, the therapist may acknowledge this by playing really slow and low tones. Likewise, if the individual is so in anger, the therapist will meet the individual's emotional state maybe by banging or playing loud and fast tones. So playing the music freely enables the therapist to form a therapeutic relationship with the client in which communication and trust is then established. Some of the sessions may bring up a range of intense and difficult feelings, but everything will be accepted and acknowledged by the music therapist, likewise to a counselling approach. However, like I've said, then barriers of talking have been knocked down. Another approach a session may take is where the therapist becomes the client's instrument. The therapist may play songs or sing to the client to see if the client can relate to that particular part of the song. And this also knocks down the barriers if the client is feeling anxious about playing an instrument. So in a session like this, the therapist or the counsellor may begin to play a song, and they might say something like "I feel," and then the client is expected to fill in the gaps with a response relating to their own personal emotions. Letting the music connect to people, allowing them not having to say much, is meant to be a really effective and powerful tool, and it empowers them, and this may be a reason for why music therapy might be so effective. Also, with the music therapy, a really good thing is that it can help individuals begin to socialise with other people, which is seen when you have depression. You isolate yourself. So music therapy can help you get back out there with society and start enjoying them things that you previously enjoyed. It must be highlighted that before music therapy is taken seriously, however, more research is needed into the effectiveness, as there is a lack of research out there in the domain. However, the limited research that is out there does show that music therapy is very effective in helping people with depression, and this is why I'm here to talk to you on this YouTube video today to help you understand more about music therapy. One of the study in 2011, if you do want to know more about it, just follow us on Facebook and I will pass you on the links. But one of the studies showed that how music therapy for adults suffering with depression, and how these individuals were involved in active music making, which was seen to build a therapeutic relationship. Results in this study did suggest that music therapy sessions greatly improved the mood and global functioning of individuals suffering with depression, just demonstrating the positive effects of such therapy. Furthermore, Martas Gold and others, in a review of music therapy, demonstrated how 4 out of the 5 studies did find that individuals who engaged in music therapy and stand-in care reported a greater reduction in symptoms of depression compared to them who received standing care alone. So therefore, this really emphasises how that when music therapy is paired with other therapies or drug therapies, that this does really help the individual, as it is that empowering tool that makes music therapy a lot different to others. Moreover, this study did show that music therapy had a relatively low dropout rate. An explanation for this could be due to the individuals enjoying the session, as it also could be suggested that music therapy does ease and improve depressive symptoms, and this is why the people really carried on going to these sessions. Music therapy has shown to be effective in treating depression, and there is research out there, and like I said, if you do want to read more around it, just let me know through Facebook. Music therapy can also assist individuals with a range of symptoms, not just depression, but with a range of illnesses such as disabilities, traumas, dementia, and a number of mental illnesses. It's really diverse, and that's because it's so catered to the individual. Finally, important question is to answer: how does music therapy seem to work? It works, and there's studies to prove this, but how? Firstly, music making enables the therapist and the client to have a specific and completely different relationship from talking methods. So this unique of the therapeutic process, like I said numerous times, it really knocks them boundaries of communication. The fact that playing music does seem to eliminate these barriers of speaking, which allows the client to express their feelings and emotional through music, which is very hard to disguise. It is the observation of mood through music making which the therapist acknowledges that helps the client accept the feelings that they are experiencing. In doing this, the therapist and the client begin to establish trust, which will assist this process. It has been found that music therapy can really improve individuals' active listening, motivation and concentration, and all of these things are seen to be affected by depression. So once these things start improving, you eventually see other things improve in turn, such as motivation, so they are motivated to maybe go out that day or do something that depression has stopped them from doing. Moreover, as already established, depression has been strongly associated with lack of pleasure and meaningless in life. Music therapy does aim to establish back this value of meaning making via a therapeutic process in an individual and artistic way. Also, as music therapy involves active doing, it's allowing the individuals to deal with the issues that are associated with their depression, It's important to emphasise that this process is shown to be conducted through a meaningful process with a trained music therapist. This therefore demonstrates how the music session can begin to produce a sense of purpose in that individual's life that may have been absent in their depression episode. A more obvious point that needs to be highlighted is how music therapy involves physical movement. As playing an instrument obviously does require movement, it is that allows the individuals to engage in the process in an empowering way that enables them to begin to see themselves as physical beings again, which depression has obviously lost. Therefore, this offers a further explanation to why music therapy may be so effective. Furthermore, as music therapy can promote control when individuals Furthermore, as music therapy can promote control, which individuals can transfer to their everyday life, it can help them manage their everyday troubles. So once they have control over their music, they may exert this control into other possibilities in their life, such as work or family life, where they feel they may not have had control before. The final point surrounding this concept needed mentioning is how music therapy is seen as a social, pleasurable experience which offers individuals a sense of meaning. Research by Talawar has shown that even individuals who normally find therapy is hard to engage in during music therapy have higher levels of involvement, therefore showing it does help an extensive range of individuals, showing the effectiveness of music therapy and offering an explanation to why this intervention is so effective in treating individuals with depression. This information on music therapy has aimed to raise awareness of what music therapy is, research that surrounds its effectiveness, and the intervention to why and how such therapies seem to work. I hope after individuals have watched this YouTube clip that they begin to understand that you don't just have to have drugs to treat depression. There is a range of other therapies out there, and music therapy is just one that can help the individuals help themselves and is seen as a really empowering tool. As I've mentioned, it does sometimes need to be paired with other therapies. However, the effectiveness of this therapy really needs to start being taken seriously. It's gone big in America, and I think it's something that really needs to be taken seriously in the UK, as it is seen to have high success rates. So that's it basically. I just wanted to inform you on things like that. And like I said, if you do want to find out more information on music therapy, we do have a Facebook page where you can get in contact with me and I can send you relevant links and things like that. Just type in music therapy and depression and it will come up, and you can just like the page and get in contact with me through then. So thanks for listening. If you have any questions, don't be afraid to ask.